Well, welcome to the webinar, the Pioneers of Healthy Lifespan Longevity Research. This is webinar number 6. We had a very good response to this webinar. People who can't join the live version will be sent the recorded version, and all the registrants will receive the slides that I'm about to show you. So this webinar today features the work of Dr. Bang and Dr. Dyerberg. These are two Danish physicians who really were the ones that uncovered sort of the secret behind omega-3 fats, especially with respect to reducing risk of cardiovascular disease. So the story is a rather interesting one. So we'll get down to it. So Bang and Dyerberg, they were two Danish physicians who loved Greenland. They had been there several times during infectious disease outbreaks. And they were looking for a way to get back there. So they decided they would try to raise some money so they could go back sort of under the pretense of doing some research where they were going to compare the health statistics, diet, and blood work of the Inuit Greenlanders to the Danish population, and also to the Greenland Inuit people who had moved to Denmark, who were now following a more Western type of diet. So the Danish diet was sort of a very westernized diet, very high in dairy products and pork. Whereas the Greenlanders, the Inuit people of Greenland, who at that time were called Eskimos, not a popular name today, of course, they were eating a very high omega-3 fat diet at the time. They didn't realize that. Halibut, seal, whale meat, whale blubber, seal blubber. So as part of the research, they actually drew blood from the Inuit people and from the Danish people and the Inuit people who had settled into Denmark. And one of the things they noticed, they had with them a research assistant who was drawing the blood named Anna Nielsen, who said, by the way, one thing I'm noticing when I do this venipuncture and I'm drawing blood is that these people, their bleeding time is very long. The blood doesn't clot very quickly. So that was sort of the first atypical finding that they saw. They couldn't explain why at the time. But through electrophoresis, even though the Greenlanders or the Inuit people of Greenland were consuming a lot of fat in their diet, they had very low levels of LDL cholesterol and sort of higher amounts of HDL cholesterol, the good cholesterol. And that was sort of atypical at the time because it was an anomaly, because the work of Ancel Keys, who had just published what's known as the 7-country study, was showing that throughout Europe, especially, the higher the fat intake, and usually with saturated fat he was looking at, the higher was the LDL cholesterol. So the Inuit Greenlander people were sort of outliers. They're eating a high animal fat diet, but their LDL cholesterol is low. And Ancel Keys didn't know what to make of that, so he just sort of ignored that for the time being. But Bang and Dyerberg went and wanted to examine this more closely. So they realized that these people, even though they were eating a lot of animal fat, had a very low incidence of heart disease and low LDL cholesterol, even though they're eating a lot of fat. And as they started to look at the lipid profile of the Inuit Greenlanders, what they saw was a mysterious fat they had never seen before. It was 20 carbons long, and the only other 20 carbon polyunsaturated fat that we had seen before, at least in that part of the world, was arachidonic acid, which is an omega-6 fat. But this was a different type of 20 carbon polyunsaturated fat. So they sent their lab work to the United States to be analyzed using sort of liquid chromatography. And in the US, they sent back a report saying these fats are actually omega-3 fats. One of them is icosapentaenoic acid, 20 carbons long, and the one that's 22 carbons long is DHA, docosahexaenoic acid. So they said, oh, we don't know much about these. What do these omega-3 fats do? Well, they published their first study in Lancet in 1971, where they were sort of comparing the blood work that they saw in the Inuit Greenlanders to the more Western Danes, and also some of the Inuit Greenlanders who had moved to Denmark. And their findings said, these changes in the lipid profile seem to be related very much to a lower incidence of ischemic heart disease, and also absence of diabetes in the Greenland Eskimos, as they call them. Then in 1972, they published again saying, look, even the Inuit people from Greenland who are living in Denmark, who are now following a more Danish Western type of diet, they have high LDL cholesterol and they have high heart disease. So the lack of the low LDL and the decreased heart disease that we're seeing in the Inuit Greenlanders who are following the more fish-based diet or seafood fish diet that's high in fat, it's not that they're genetically protected against heart disease, because as soon as they adopt the more westernized diet of pork and meat, their LDL goes up and their incidence of heart disease goes up. So something about these fats that they're consuming from fish seem to play into a reduction in risk of coronary heart disease as well as decreased diabetes. But the real breakthrough moment came because, in 1971 and 72, I was still in high school, and no one was talking about eating more fish in the early 1970s. The big moment came in 1980 when they published in Advances in Nutritional Research this paper outlining lipid metabolism and ischemic heart disease in what they called Greenland Eskimos, or the Greenland Inuit people. And they're saying, look, in this period of time, we've been following these people from 73 to 76. Death from ischemic heart disease constituted only about 3.5% of all causes of death. That's very low. In the Western world, ischemic heart disease and related cardiovascular problems account for about 40% of all deaths. And so they're saying what we're seeing here is that something about these omega-3 fats that they're consuming seems to be protecting them against myocardial infarction, whereas Inuit people who are not following this diet have the same heart disease risk as the rest of the Western world. So that's when the mainstream media and the medical profession started to pay attention to this. So it was in the 1980s that the recommendation of eating more fish started to become more popular. And since then, there's been a ton of research that has followed. But it was Doctors Bang and Dyerberg that really discovered this sort of anomaly where a high-fat diet could be protective against cardiovascular disease. So since then, research has led to our understanding that we have today that those omega-3 fats, particularly EPA, get converted into prostaglandins or eicosanoids that are series 3, which reduce the stickiness of our blood. So our platelets become less sticky when there's more omega-3 fats in there, because those omega-3 fats become prostacyclins that reduce platelet stickiness. And that accounted for that longer bleeding time that we mentioned earlier. But you also have fewer abnormal clots that form, so you have less myocardial infarction, ischemic strokes, and other cardiovascular conditions. You have this anti-thrombotic effect. The other thing is that those omega-3 fats being converted into prostaglandin series 3 also reduce inflammation in the blood vessels, but also in the joints of the body and in the brain. And unlike saturated fat, when you have omega-3 fats, it doesn't raise your LDL cholesterol because it tends to help increase LDL cholesterol clearance by upregulating the LDL receptors on our cells. And it seems to increase HDL a little bit in some people, which the combination may slow and or reverse atherosclerosis. So here you see one of the things that they published. You see the EPA level. Here's the orange bar. This is the EPA icosapent pantanoic acid blood level of the Inuit Greenlanders versus the Inuit people who had moved to Denmark and were following more Danish diet, a Western diet, pork and meat. And again, here's the DHA comparison. In the Greenland Inuit people, higher DHA, and in the Inuit people that moved to Denmark who were following a more Western diet, the DHA levels are much lower. And those correlations were directly linked to less ischemic heart disease and less diabetes, thrombotic activity in the higher EPA DHA Inuit people. So our current understanding of all of this really plays out this way, as I've told you before, that when you consume polyunsaturated fats of any kind, whether they're omega-6 or omega-3 or omega-9, like olive oil, you're getting You're getting oleic acid from olive oil and avocados and nuts. But those polyunsaturated fats get incorporated into the cell membrane of our cells, as part of the phospholipid structure. And every 15 minutes, phospholipase A2 releases some of the polyunsaturated fats, converts them into eicosanoids or prostaglandins, little mini hormones. And the different different eicosanoids have different effects on how the local tissues are going to behave. So the types of fats that are in esterifying our cell membranes are the types of polyunsaturated fats that we get from our diet. So if you change your polyunsaturated fat intake, it's going to change the inflammatory cascade in your body, how sticky your platelets are, and other factors. And the half-life of the polyunsaturated fats, about 300 days. So it takes about a whole year to really change your body's internal profile of fats in your cell membrane. And this is very important because every 5 to 15 minutes, as those polyunsaturated fats get converted into prostaglandins, they have significant effects. So prostaglandin series 2, which you make from arachidonic acid, is very pro-inflammatory. Whereas the prostaglandins that are made from prostaglandin series 1 and series 3, and series 3 comes from the omega-3 fats, is very anti-inflammatory. So the foods and supplements that you put into your body with respect to polyunsaturated fats largely determine the body's background inflammatory landscape, and also how sticky your blood is going to be, and also the rate at which your cells divide, because prostaglandin series 3 slows down the rate of cell division. So does prostaglandin series 1. So arachidonic acid from high-fat meat products especially gets converted into prostaglandin series 2, producing a lot of inflammation and upregulating other important transcription factors that will then cause cytokines to be released that also produce even more inflammation that we see in autoimmune diseases and in cancer. It also speeds up the rate of cell division, which is linked to greater cancer risk, makes your platelets a lot more sticky, and it's linked to a greater risk of dementia and Alzheimer's disease, as well as depression and brain inflammation. So those high-fat meat products, not only do they have saturated fat that raise cholesterol, but they contain arachidonic acid, which is a polyunsaturated fat. It becomes prostaglandin series 2. Very, very undesirable for so many reasons. Whereas the EPA, icosapentaenoic acid from fish and fish oil, become prostaglandin series 3, which decreases inflammation, downregulates the transcription factors for cytokine release related to inflammation, linked to decreased cancer risk, also shortening telomeres because you're slowing down the rate at which cells divide, linked to improved memory, decreased brain inflammation, decreased depression, because you have better fluidity of the cell membranes of your brain cells so they can receive signals better, decrease postpartum depression, decreased platelet stickiness, which helps to reduce abnormal clots forming in your system. So less thrombosis, and linked to decrease arrhythmias as people get older, and also keeping blood pressure lower because it dilates blood vessels so the blood can flow more easily. The heart's not struggling to pump blood through the system. And also gamma-linolenic acid, even though it's an omega-6 fat, also is converted to prostaglandin series 1. So omega-3 fats are converted into prostaglandin series 3, but gamma-linolenic acid becomes prostaglandin series 1, also anti-inflammatory. It's been used for skin conditions, neuropathy, slowing down the rate of cell division, and to reduce inflammation, as I will show you. So as we look at some of how this works, remember that all your cell membrane has these biphospholipid, these phospholipids, and there's 2 layers of them. And the phospholipid structure, of course, is a glycerol backbone. And then the kind of fats that you have in your diet become the fats that are linked to the glycerol backbone. And then on the other carbon, you're going to have a phosphate group like choline or serine or ethanoalamine. And these, when the R2 group, when this group is DHA, by the way, it really helps the brain make more acetylcholine, which is important for memory. So DHA becomes very important to increase memory in the brain. if you have enough choline, if this particular carbon is attached to choline and the R2 carbon right here has DHA, it's going to help your brain make more of the memory chemical and decrease risk of dementia and Alzheimer's disease. Most people don't get enough choline or DHA over their lifetime. When you have a lot of arachidonic acid esterifying this, phospholipase will cleave that off. Remember that drugs like cortisone and cortisol and prednisone, they're going to help to block this enzyme. That's why for people that have out of control autoimmune diseases, they often give them prednisone, right, to block phospholipase A2 from releasing these arachidonic acid molecules to become prostaglandin series 2. But most of the time, arachidonic acid, when it gets released, it becomes prostaglandin series 2, which increases inflammation and it increases the amount of thromboxane A2 in your platelets, so they become very sticky and you promote a lot of inflammation. In your white blood cells, arachidonic acid becomes leukotriene B4, and that promotes a lot of inflammation from your white blood cells, which we see in autoimmune diseases. So the more arachidonic acid you have in your cell membranes, the worse the health situation is going to be for most people. And so this is just showing you the same thing, arachidonic acid becoming prostaglandin series 2, very inflammatory, and via lipoxygenase in white blood cells producing more inflammation in white blood cells. So you see that played out here again, like arachidonic acid becoming pro-inflammatory, whereas icosapentaenoic acid, EPA from fish and fish oil, becoming these anti-inflammatory prostaglandins and leukotrienes. It changes everything. So when you look at this on a larger scale, not to get too deep into the weeds, but arachidonic acid, as I said, becomes all these inflammatory prostaglandins and makes platelets very sticky. Linoleic acid from corn oil and many other vegetable oils can also become arachidonic acid. But if you supplement with gamma-linolenic acid from borage seed oil, it usually will help to make this conversion and become prostaglandin series 1. If you have enough antioxidants and magnesium and zinc, it actually helps gamma-linolenic acid become dihomogamma-linolenic and then prostaglandin series 1. Notice that alpha-linolenic acid from flaxseed oil can also be elongated to EPA and also to DHA if your body needs the DHA. And these are very anti-inflammatory, and DHA is important for brain development and for vision and for some other specialized functions in the body. So this is just sort of a review of that cascade of alpha-linolenic acid from flaxseed oil becoming EPA and also DHA, and how linolenic acid can become arachidonic acid, but the importance of gamma-linolenic acid in forming prostaglandin series 1. And here you see gamma-linolenic acid becoming dihomogamma-linolenic. And then with antioxidants like vitamin C and vitamin E and B6 and zinc and magnesium, it enhances this conversion to prostaglandin series 1, which is very helpful for skin inflammatory diseases, certain neuropathies, and to reduce inflammation in the body. So just to review what some of these molecules look like, here's alpha-linolenic acid, an omega-3 fat. It's 18 carbons long. The first double bond occurs between carbon 3 and 4. Here's icosapentaenoic acid, 20 carbons long. But here's arachidonic acid, also 20 carbons long. The difference is this is an omega-6, and icosapentaenoic acid, EPA, is an omega-3. And that small difference in where the double bond sits changes the impact on the body's physiology very dramatically. The other thing to know is that icosapentaenoic acid and DHA also produce these anti-inflammatory resolvins, which we've learned in recent years. They have this secondary anti-inflammatory effect. So I thought I'd just show you quickly some of the current research in recent years looking at omega-3 fats in cardiovascular research. A number of very good studies showing its reduction in pro-inflammatory effects, less platelet stickiness, protection against cardiovascular disease here in the Journal of Nutrients in 2019. New England Journal of Medicine in 2002. Evidence shown that patients with higher mean baseline blood levels of omega-3 fats have lower risk of cardiac sudden death. The Mayo Clinic in 2014. There can be little doubt that myocardial omega-3 fats plays a physiologic role in the prevention of life-threatening ventricular arrhythmias, and that high-level omega-3 fat intake has potential to benefit vascular health via additional mechanisms. Then we see in 2014 the results of a major clinical study involving over 11,000 patients who had recent myocardial infarction with 1 gram per day of omega-3 fats reduced the occurrence of death, cardiovascular death, and sudden cardiovascular death by 20, 30, and 45%, respectively. And then there's this omega-3 fat index. When the amount of omega-3 fats is 8% or more of the amount of fats esterifying the phospholipids in your red blood cells, that's very strongly linked to decreased risk of many cardiovascular problems. Even in young people who are starting to trend towards higher blood pressure, it helps to bring their blood pressure into the more ideal range. Flaxseed oil studies, which contains a lot of alpha-linolenic acid, omega-3 fat, has been shown to do all these wonderful things in people who are at high risk for cardiovascular disease. It reduced the development of atrial fibrillation, reduce sudden death, non-fatal heart attack. All these great studies. Flaxseed oil is very important, not just fish oil. That was the point I'm trying to make here. With respect to arthritis, a lot of great studies in recent years showing that omega-3 supplements have helped for rheumatoid arthritis. A number of studies have shown that. You see study in 2012 and again in 2012, the Mediterranean Journal of Rheumatology in 2020, also saying that omega-3 fats have been shown to ameliorate and prevent experimental arthritis and may decrease disease activity in rheumatoid arthritic patients. Other studies in 2016, the British Journal of Nutrition, a systemic review of all the research on omega-3 and arthritis in 2012. These are all great studies to look up, including borage seed oil in patients with rheumatoid arthritis, showing decreasing many of the pro-inflammatory factors, because gamma-linolenic acid becoming prostaglandin series 1 also helps to reduce inflammation. It's not just omega-3 fats that do it. Studies on patients with depression have shown that omega-3 fats can help as an adjunct to improve depression outcomes, and in women with depression during pregnancy and postpartum depression, sometimes used as a single intervention, has been shown to be very helpful. So you see, I've given you all the studies there that show that. It's remarkable stuff. Patients with PTSD, omega-3 fats also helpful. Also preventing memory loss and dementia, a lot of great studies there showing how omega-3 fats decrease the buildup of beta amyloid plaque, decrease brain inflammation, increase the fluidity of the cell membrane so signals can flow through, the better nerve transmission, increasing blood flow to parts of the brain so they get the nutrients they need to keep them alive. A lot of very important research on omega-3 fats preventing Alzheimer's disease. And here are the key studies that I've given you. In cancer prevention, because when you reduce inflammation in the body, you tend to reduce cancer. And when you slow down the rate at which cells divide, you also tend to reduce cancer risk. So there's a lot of good studies showing that omega-3 fats may also help to prevent cancer. Studies showing that it helps to manage premenstrual syndrome in 2017. When you have more omega-3 fats that you supplement with, the skin cells pick it up, and skin cells tend to be less prone to skin damage induced by ultraviolet light. It's one of the ways you can help to protect your skin. I mean, you want to avoid ultraviolet light, excessive amounts, of course, and you want to, protect your skin with the right sunscreens, in my opinion. Antioxidants that you take from food and supplements also helps to get into the skin cells and protect them. But omega-3 fats have also been shown to reduce ultraviolet light damage to skin cells if you supplement with them. DHA, very important for vision and for retinal development. DHA is also important for brain development during the last trimester of pregnancy. The maternal amount of DHA is very important because it crosses the placenta, gets to the infant's brain, or the fetal brain for brain development. Critically important. And the first 6 months of life, too, breast milk being high in DHA has been shown to further help in brain development. So this is all stuff that's worth reading. We see it can help to improve insulin sensitivity and decrease inflammation in diabetics, helping to manage their condition as an adjunctive measure. Helps to reduce childhood asthma severity if you give children with asthma omega-3 fats. Improves pregnancy outcomes by decreasing by increasing the infant birth weight and by decreasing premature birth. So women who are supplemented with omega-3 fats during pregnancy tend to have full, long pregnancies and give birth to children, or infants that have higher birth weights, which makes them healthier and less prone to all kinds of problems. So that's all the research there. The Cochrane review is very convincing. And here are some of the studies that are tremendously important to look at. The Nurses' Health Study showed that of the 80,000 nurses, the ones supplementing with flaxseed oil, much lower incidence of developing multiple sclerosis, a 40% reduced risk. Also, longevity studies. Look at this study following 2,200 people who were over the age of 65, who were monitored for 11 years. The results showed that individuals with higher amounts of omega-3 fats in the phospholipids of their outer membrane, they had higher omega-3 indexes, right? They had longer life expectancy, 5 years longer than their cohorts, just that one change. Also, we see that omega-3 fats have the potential to re-lengthen telomeres, which makes cells healthier and less likely to become senescent and less likely to get converted into cancer cells. As their telomeres shorten with each cell division, there's a greater chance the cell will morph into a cancer cell or go into senescence where it stops functioning, but it starts to produce inflammatory cytokines. So lengthening telomeres is a huge thing if you can do it. And this is just one of the studies showing the effects on oxidation and telomere length that's worth looking at. So my 30 minutes is up. So what I want to tell you is I have a whole 1 hour comprehensive webinar on essential fats in health and disease that you really should see. I'm giving you all those links there, but if you want to see me present it in, taking my time in a little more detail, that's the link to click on to see that full 1 hour webinar that I have on essential fatty acids in health and disease that I think every practitioner should see at some point. So this is sort of high level overview. Of course, at Adiva, I formulated Nature's Essential Oils, which has a high yield fish oil, lots of EPA and DHA, but also flaxseed oil and also borage seed oil to try to maximize the effect of all these essential fatty acids on reducing inflammation, cardiovascular benefits, brain benefits, slowing down the rate of cell division, the effect on skin texture and protection against UV light, managing some skin conditions, on PMS, improving vision, maintaining vision, helping to manage better diabetes, and also the positive effects we've seen now on fatty liver conditions, also on longevity and telomeres, pregnancy outcomes, asthmatics. This is a premier supplement to have top of mind for anti-aging, disease prevention. I think everybody should take that formulation unless there's a reason not to. It works best, of course, with the Adiva high potency multivitamin because it has all the antioxidants, the B vitamins, the zinc, the magnesium to really help convert those essential fats into prostaglandin series 1 and series 3. And if that's the whole formulation of the Adiva multiple vitamin, you're probably familiar with it. Antioxidant enriched, has the whole B50 complex, the first 500 milligrams of elemental calcium, selenium at 200 micrograms, very important, lycopene, lutein, everything. So this is this 1-2 combination. Most of your adult patients would benefit from taking these two as sort of foundational products, in my view. So we owe these guys a great debt of thanks, Dr. Bang and Dyerberg, and also Nielsen, who was their lab tech, who first noticed and published the first paper with them, showing that these people, the Inuit Greenlanders, had longer bleeding times, prothrombin time, which was what, you know, the finding that that Nielsen brought forward to the group, because they didn't know that. They were just the physicians sending people to a lab. And Nielsen said, wait, you know, these people you're sending, these Inuit people, I can't stop them from bleeding. It takes a long time before I can get the bleeding to stop. So that was already eye-opening at the time. So I'm very grateful that you would sit in today. I thank you very much for sitting in. I'll have another webinar next month on another pioneer of healthy lifespan and longevity. So thanks once again for being part of this today.